Free-flowing Quickie! This is an example of the kind of hysteria and misinformation going around during the COVID-19 pandemic, the fear that vaccines cause blood clots. This isn't just an anti-vax conspiracy theory, it was spread throughout the mainstream news media and caused the European and Australian governments to delay the introduction of the Johnson & Johnson and AstraZeneca vaccines. It started when AstraZeneca reported, as they're required to do, several cases of deep vein thrombosis in patients who'd received their vaccine. One problem is that people took that information and ran with it without looking at context or causality. Another problem is that researchers gave it a name: vaccine-induced immune thrombotic thrombocytopenia. Another problem is they gave it a stupid name. But if you name something, people psychologically think it's real, even if it's not a real effect. You might be forgiven for thinking there's something to it, since blood clots are an adverse effect of COVID. But the vaccines don't contain the entire virus, just the spike protein. Researchers kept publishing all sorts of papers and reviews about what might cause it, from contaminants in the vaccine to a small autoimmune response. But few people seem to have actually looked at the numbers to see what they were. We're talking about just 15 cases of DVT out of 17 million doses. In the Johnson & Johnson vaccine, it was 6 out of 7 million doses. Literally 1 in a million. But that's exactly what you'd expect in a similar population even without the vaccine. Actually, it's a bit lower, but before you go wondering if that means the vaccines somehow protect you from blood clots, it's really difficult to know if it's a real effect when the numbers are that low. It's not that it isn't worth studying whether there could be a slight risk, but don't go hitting the panic button because the numbers are exactly what we'd expect. If you're really worried about DVT, then exercise more, lose some weight, and stop smoking. Those will lower your risk way more than any vaccine might potentially increase it.